I got into politics because politics got into my business. Politics injected itself into the practice of healthcare, in particular, the practice of pediatrics, in a way that is harming kids and families in every corner of this country. We see kids who don't know where their next meal is coming from, kids who have to spend the night in these hospital rooms alone because their parents are juggling multiple jobs just to make ends meet, kids with chronic diseases like asthma and diabetes whose parents can't afford these medications, kids who are in the throes of a mental health crisis can't find mental health resources, and every pediatrician has taken care of a child with bullet holes in them. So it was too much for me. And as a type A person and a problem solver, I started to look for solutions. And I very quickly realized these are policy problems. These are systemic problems that are hurting our kids and families before they ever walk into the doors of a pediatrician's office or a children's hospital.
You are fighting for values here. So this isn't about, to be honest, this isn't about red, blue, person. It's about what value system is this person bringing. And I'm shocked when people are like, yeah, I don't want to get involved, or I'm just like, and there's so many different ways to do it. You don't have to be on stages and running for office like you are, but you can be voicing and getting into local grassroots organizations and really fighting for those kids.
So I'm running for the U.S. Senate, which is a very dramatic way to engage in politics. But there are so many other ways pediatricians and people who care about kids can engage politically. They can find local candidates to get behind and support. And what support for political candidates looks like is a lot of things. It's showing up at their events. It's volunteering to text bank and phone bank and knock on doors. It's using your social media accounts to amplify the folks who are brave enough to put their names on the ballot. And most importantly, sadly, it's donating to candidates who have the audacity to run, because it's a thankless path most of the time, but it is such a necessary path. So we need to support people when they're brave enough to step into these spaces.
Welcome back to the show. You are listening to the PedsDocTalk podcast. I am Dr. Mona, your favorite online pediatrician and mom friend, and someone who really cares about advocacy for our children in so many different ways. I am so excited to keep continuing to bring amazing guests on this show, and today's guest is no different. She is Dr. Annie Andrews, a pediatrician and mom who has dedicated her career to fighting for a brighter future for all children. She's running for the U.S. Senate to fight for the South Carolina families and kids who have been left behind by Washington. She is a dedicated pediatrician, public health expert, and he has spent her entire career on the front lines treating kids with gunshot wounds, kids whose families can't afford insulin or even their next meal, and kids in mental health crises with nowhere to turn. She knows that the corruption and the BS out of Washington hurts real families and that our kids pay the price. And just saying that gets me so much in my feels to see a fellow pediatrician trying to do the next step and fight for our children in the U.S. Senate. Dr. Annie Andrews, Senate hopeful, thank you for joining me as we talk today about healthy kids and how we need healthy policy, the case for advocacy. I'm so honored to have you on my show today.
Thank you so much for that kind introduction, Dr. Mona. I'm really pleased to be here today.
You know, one of the biggest things that I get a lot on my platform is, Dr. Mona, don't get political. And you're the first politician I'm having on my show, right? Meaning the only reason I even wanted you on is because you are also a former pediatrician. And I do think it's important that we share the importance of why having doctors who are advocating for our children and now running for Senate, have their voice heard. I want to start with the obvious, which people may not know about, but you have a thriving pediatric career. You've been working for decades, I was told, and you're also a mother. But what made you make this jump into politics and made you realize that this was the next move that you needed to do in your life?
It's interesting to hear you call me a politician because I still don't identify as a politician,
yes.
even though
that's why I love you.
Yeah. And I hope to never fully identify as a politician. And I still am a practicing pediatrician. I work very, very part-time at the Children's National Hospital in Washington, D.C., taking care of sick and injured children in our nation's capital. I got into politics because politics got into my business. Politics injected itself into the practice of healthcare, in particular, the practice of pediatrics, in a way that is harming kids and families in every corner of this country. You talked at the outset about what we see when we work in a children's hospital. We see kids who don't know where their next meal is coming from, kids who have to spend the night in these hospital rooms alone because their parents are juggling multiple jobs just to make ends meet, kids with chronic diseases like asthma and diabetes whose parents can't afford these medications, kids who are in the throes of a mental health crisis can't find mental health resources, and every pediatrician has taken care of a child with bullet holes in them. So it was too much for me. And as a type A person and a problem solver, I started to look for solutions. And I very quickly realized these are policy problems. These are systemic problems that are hurting our kids and families before they ever walk into the doors of a pediatrician's office or a children's hospital. So I looked upstream to my state capital in Columbia and to Washington, D.C., and I didn't see enough people fighting for our kids. And I looked around the room at folks who are making these decisions in South Carolina and in Washington, D.C., and I realized I am more than qualified to be in these rooms where decisions are being made. So I just took the bold step to dive into politics and run for office.
Well, I love that you already identify yourself as a pediatrician and mom. That is exactly why I support you and why I love your campaign. I found you through a friend who I believe knows you, Dr. Anita Patel. She's a PICU doc in the DC area, and she sent me one of your campaign videos, and I was like, "Oh my gosh, like this is amazing!" And obviously, We don't have to go into detail of that campaign video, but it was just exactly what I think this world needs, right? This sort of shake up, this sort of understanding. And there's no better person, in my opinion, to do this than a pediatrician who's been working in hospitals, in offices, because it is upstream, right? We forget that all these issues, like you just mentioned, don't just start when people are 20 years old or adults. Like, what are the health access? What is the safety access? We see that every day as pediatricians, how broken the system has become. And I think you've probably seen that throughout your career, right? Like how it continues to become broken, especially in states that don't prioritize this. And that tends to be a lot of red states. I'm in Florida. I see a lot of kids left behind here. I used to grow up in California, which, yes, it's there to some degree, but it's not to the degree that I'm seeing it in these states. And so I don't know if you see that same sort of reality, that you see that now this is becoming a very, very like red, blue, where are the kids going to be left out in this situation, and how that makes you feel as a mom and pediatrician to see that these policies are really hurting kids.
It's heartbreaking and it's deeply frustrating because
Yes.
we are data-driven professionals, and there are answers to these solutions, but there are bad politics standing in the way of our elected officials passing the policies that we know will benefit America's children. So you're right, there is a discrepancy between how kids in red states are doing and how kids in blue states are doing. But here in America in 2025, what I fear is the country is going to turn into one big red state where kids are getting left behind. And the reason why children are getting left behind is quite simple. It's because children are not inherently a politically powerful constituency. Children don't vote. Children don't donate to candidates. Children don't support political action committees. And therefore, they are left behind. They are at the bottom of the priority pile in nearly every member of Congress's desk because they are not inherently politically powerful, unlike Americans over the age of 65, who are an
Right.
incredibly powerful political constituency. So it is incumbent upon those of us who care about America's children to build political power on their behalf. Running for office is one way to do that, to draw attention to these issues. That's why I was so pleased my campaign video went so viral, because I want
Yeah.
more eyes and ears on the words that are coming out of my mouth, because I am so deeply passionate about building a political movement that centers America's children, that I want everyone who cares about America's kids to understand that this is one of the key reasons our kids are being left behind, because we're not engaging in politics on their behalf.
Yeah. And I mean, we know that so many of the policies just don't care about children and families, right? We go into paid leave, we go into the whole Medicaid crisis, which we'll be talking about now, and how that's going to negatively impact so many, and how I'm already seeing the impacts as a Florida pediatrician that accepts a lot of Medicaid patients. And I think, we will get into that. And you've said healthcare shouldn't be political, but in America, it has been. And many doctors are taught to stay neutral. But you've also made the case that neutrality can be harmful. So what would you say to other healthcare professionals who are hesitant to speak out, or to that person listening and saying, why are we talking about politics when this should be about parenting or our children?
So you can't fight bad politics by staying apolitical.
Yeah.
And honestly, I wish I could just have stayed with my full-time career of being a pediatric hospitalist. But what I saw every day drove me to find solutions, and the solutions are political. And that is
Yeah.
just the reality. And because of this unwritten curricula we experience in medical school and in our residency training, that we must stay apolitical, that we must stay neutral, we have given up our seat at the table. We have
Mhm.
abdicated our responsibility. And there is no graver concern that I have than pediatricians who are sitting outside of politics, because,
Yeah.
there's other physicians who do a pretty good job advocating for their professions. Anesthesiologists, orthopedic surgeons, radiologists, they all are engaged in politics through their organization's political action committees. But pediatricians have given up a seat at that table because pediatricians are the only medical profession that hasn't built a political action committee. And we just have to get sort of over ourselves, because we are doing our patients and families a disservice by failing to engage in enacting the policy solutions that will benefit them. And I talk about this all the time when I travel around the country to talk to future pediatricians. We all understand what research is. Research is finding the answer to a problem. Policy is putting that answer into a systemic solution. Advocacy is going up to the elected officials, trying to convince the people in power to care about your problem and to care about your proposed solution. But if we stop there, if we stop at advocacy and we don't do politics, we're missing the whole game, because politics is changing who has the power. And think about how powerful that can
Yeah.
be. If we change who is in these seats of power, if we start electing people who wake up every day and have children as their priority, how much easier it would be to pass something like an expanded and permanent child tax credit, to pass something like, expanded Medicaid throughout this country, to lower the cost of prescription drugs, to fully fund our public education system, to act urgently on climate change. All of these things that are affecting America's children, we have policy solutions, but if we don't engage in politics, we're never going to get to where we need to be.
I love it. I mean, we could just end it right there. No, I mean, like, this is exactly it. And I actually started my advocacy desire in the pandemic, right? That's when I started my platform, and the advocacy had to be around vaccines and public health, right? That was what was really prominent at that point. And it was hard. And, my message to a lot of people who are fearful of it is like, you are fighting for values here. So this isn't about, to be honest, this isn't about red, blue, person. It's about what value system is this person bringing, and to not make certain policies in a reality is a problem. I mean, we have to care about the kids. We have to care about all access to all children. And then obviously you talked about gun safety and cost of medicine. All of that impacts lives. And why don't we care about that? Like, I'm shocked when people are like, yeah, I don't want to get involved, or I'm just like, and there's so many different ways to do it. You don't have to be on stages and running for office like you are, but you can be voicing and getting into local grassroots organizations and really fighting for those kids, which I'm trying to do a lot of. And I'm so inspired by you, because I don't know if I would ever run for office. People are always telling me to do it,
I'm
but
sure.
seeing you is inspiring. Like, I'm inspired to continue to advocate when I see fellow pediatricians, fellow moms, fellow, healthcare professionals do that. And that is a ripple effect that I agree that we can't stay out on the sidelines and just say, well, changes will happen if they happen. They're not. And it's getting worse, in my opinion. And I think you feel the same.
It absolutely is getting worse. And it isn't about red or blue. I think people
Yeah.
watch me now and assume I've just been this like hardcore Democrat my
Yes.
entire life. I was actually pretty apolitical, because I had the privilege to be apolitical in my 20s. And then when I became a mom and saw the world around me, that gave me the courage to engage. And then I looked at our two political parties, and there's one that is very clearly fighting for America's children, and one that is not. That is not
Right.
my fault. I did not write the Republican
Right.
Party's policy platform. If both parties had different approaches to fighting for America's children, I would love to have two choices. But the fact of the matter is, in 2025, in the United States of America, there is one political party that prioritizes America's children, and one that is actively working to make their lives worse by taking away the SNAP benefit program,
Yeah.
by essentially gutting our nation's Medicaid program, which is the largest insurer for children in this country. So yes, it does feel a little bit unsavory for those of us who are healthcare professionals to really engage in politics in this manner, but we have no choice. This moment is so incredibly urgent, and as you said, grows more urgent by the day. So I see my politics just like I see my practice of medicine. When I walk into a patient's room, it's not about red or blue. It's about
Yes.
assessing the problem, making a diagnosis, and coming up with a solution. The same thing as when I'm talking to voters in South Carolina. I walk in, I listen first, I together develop a solution to their problems, and then I work to enact that solution.
I agree. I love this. I mean, I think, I want to talk about you winning. So I'm a big believer in not saying if, I'm gonna say when. Okay. And I know you're like, oh, Dr. Mona, but when you win. Okay. So when you win, Dr. Annie, because I want this to happen so bad, not only for South Carolina, but it's gonna impact the nation. I believe that so deeply. When you win, what's one child health policy you'd want to tackle first and why? And I know you talked about the Medicaid, SNAP benefits, but what is that one policy that you really want to be on the top of your list?
So, first, I'll acknowledge we're going to have a lot of rebuilding to do
Yes.
to build out the social safety net that supports so many American children. But my policy priority, my number one priority, it's hard to pick just one, but it is
Yes.
passing a permanent, expanded, fully refundable child tax credit, like the one that went into effect during COVID, which lifted millions of American children out of poverty. But that tax credit expired, and now we have a smaller tax credit. And we should have broad bipartisan support for a policy solution that is so incredibly effective at lifting so many children out of poverty. And there is some bipartisan support, but not nearly enough. But that would absolutely, without a doubt, be my number one policy priority because I know it would directly benefit so many children and families in this country.
Absolutely. And you've also talked about Medicaid as well, right?
Mhm.
I mean, how Medicaid isn't just a budget decision, it's a moral one. So, what do you think it says about how children are valued in this country when policies like this pass? Like for recently, obviously, the cuts that are coming that I believe are not going to take effect until after the next election cycle, but are still on the block to happen.
That's right. It says everything you need to know about the current members of Congress and the current administration in the White House's priorities, and as far as that impacts children. What we are witnessing is an unprecedented, coordinated attack on our nation's healthcare system through gutting of the Medicaid program, cuts to the Medicare program, failure to act to lower the cost of prescription drugs, slashing NIH funding. It's truly unprecedented. And
Mhm.
the appointment of RFK Jr. to lead the Department of Health and Human Services was that straw that
Yeah.
broke the camel's back that really made me decide to run for the US Senate. But what so many people don't understand about the Medicaid program is that it is the number one insurer for children in this country. It funds 40% of the births in this country. In South Carolina, it funds 6 out of 10 nursing home beds. But
Yeah.
it has the program has a PR problem because all those constituencies I just mentioned, children, pregnant women, and folks in nursing homes, again, are not a powerful political constituency. So they get steamrolled when we have members of Congress who lack the moral authority and the moral courage to fight for the most vulnerable members of our community. And that's why I'm running, because I promise anyone listening that every single vote I take when I am a US Senator will be to benefit America's children. That is my North Star. That will never change.
And I love the stat that you mentioned. So, a lot of people don't realize that Medicaid supports 40% or more of all births in the United States. In Florida, I believe the number is close to 50%. I believe ours is like 47% on enrolled in Medicaid. And then when you include CHIP, that can also be 66%, which I can say that that's real with what I see in my office. My office takes care of Medicaid and takes care of non-private insurance, but it's a huge part of my clinical practice. And so, why do you think that there's such a gap between how critical this program is and how me and you know it's critical and how little attention it gets in public debate?
Because people misunderstand the problem. And
Mhm.
honestly, part of that is our fault as
Yeah.
pediatricians because we haven't been an effective vocal advocacy constituency for very long because we just assume people would keep their hands off of America's children, but we can't count on that. And so it is our job every day from now until the midterm elections in November 2026 and beyond to share with anyone who will listen how critical the Medicaid program is to children's healthcare in this country. I mean, it truly is the backbone of our children's healthcare system in this country. And what I think a lot of people also don't understand is this impacts all of us. So when you take that much money out of any system, the money that they're taking out of the Medicaid system, you cannot expect the system to continue to function anywhere near the level it was functioning before. So immediately what's going to happen is hospital centers, hospital systems are going to cut back on service lines. They're going to have to close rural hospitals. They're going to have to freeze hiring of nurses and doctors and respiratory therapists. That's going to increase wait times in emergency departments. It's going to block access to care to Americans who live in rural areas. And then all of these folks are going to become uninsured. But you and I both know that just because you lack health insurance doesn't mean you're not going to get sick or injured. So when you get sick or injured, you're not going to have anywhere to go. So you're going to stay home. You're going to wait until you are sicker. And then you're eventually going to show up to an emergency department, which is the only place that you can access care. And thank God for now, emergency departments are legally required to provide that care regardless of your insurance status. So these patients are going to get care at our hospital systems, and that care is going to have to be paid for. So hospital systems are already looking at their bottom line. They're going to have to find a way to compensate for that care, and they're going to start charging our commercial insurance companies more, which is going to raise our premiums. So this directly impacts every single American who uses our healthcare system in a devastating way. And eventually hospitals are not going to be able to charge the commercial insurance companies enough to make up for this gaping hole in their budget because of the Republicans' Medicaid cuts. And the whole system is just going to collapse. And I know by watching, the Republicans don't have a plan for that. They don't have a plan for that. They don't care about sick and injured children and vulnerable patients with chronic illnesses who are no longer going to be able to access healthcare. And it is deeply a moral issue to me. And that is how I will fight on it. And I do believe this will be the leading issue in the 2026 election cycle, which is why it is so imperative that more physicians find the courage to speak up and to engage in politics.
So I mean this timing of this recording is so perfect that on Friday I was at clinics. I'm very reduced hours as well, and I'm in clinic. And I would say 60% of my patients are Medicaid and 40% are self-pay or private insurance. And I saw in a morning, I saw about 25 patients in a 4.5 hour session. And people are always like, why do you guys have to see so many patients? And I want to explain it from the general outpatient pediatric side. In order to keep people employed, pay the staff, pay for vaccine storage, all the costs of medicine, we need to see patients, and we get reimbursed by insurance companies. Medicaid already, and you can correct me if I'm wrong because I have a feeling you know way more about Medicaid than I do. Medicaid already doesn't reimburse us to the level of a private insurance company. So if we need to basically see 3 to 4 Medicaid patients to equal the reimbursement an insurance company will pay us for a private insurance child for a well visit. So now we are not only seeing so many patients because these patients need care. They need to be seen, but they also now tend to have a lot more complicated issues because of the unfortunate reality that many families on Medicaid are also lower income, also have lower access to healthy foods, exercise, nutrition, support systems. It's a vicious systemic cycle that I am now taking so much time with these families, and they're overbooking my schedule, and everyone's waiting. So it is a thing that affects everyone. Not only are the Medicaid families not getting good care, the non-Medicaid families are not getting good care because they are not getting the time with me that everyone should deserve, whether you have private insurance or Medicaid, because in order to keep our lights on. And it's frustrating. And so my fear, and I talk to a lot of my colleagues, is if there's Medicaid cuts, how's that going to impact reimbursement? How's that going to impact how many patients we have to see? It's already, for lack of a better term, a shit show. We can't do it. And then adding on, Annie, like the fact that the mental health resources for anyone, especially Medicaid families, are horrible. So I'm trying to find therapists. I'm trying to find people for my community, and I can't do it. And it's very demoralizing as a general pediatrician. And I know you know this because you practice. It just feels like your hands are tied, and you're like, I know I can make a difference, but I can't because of insurance. I can't do it because of the volume of patients, and it's affecting everyone. Doctors are going to leave, clinicians are going to leave, patients are going to be struggling. And I don't think people are wrapping their head around how this is not just a low income Medicaid problem. This is a everybody problem. And you mentioned the ER.
Mhm.
They're going to be seeing it. And my husband will be telling me that all these little kids will be coming in with really bad asthma attacks, really bad, maybe in DKA when, we didn't catch it fast enough because they couldn't get the care. It is catastrophic. And I'm concerned with the future of pediatrics and healthcare, but especially our profession.
Yes, pediatricians are hanging on by a thread, and it is demoralizing. And the fact of the matter is, America has a profit centered healthcare system that
Yeah.
benefits insurance companies and pharmaceutical companies and some of our for profit hospital systems. We do not have a patient centered healthcare system, and we do not have a provider centered healthcare system, which is why rates of physician burnout are sky high, why physicians are leaving clinical practice in droves. And what just passed in this big, ugly bill is going to make this problem so much worse. And I have to say this because I'm running for office. It is really important that we understand that they didn't decide to cut the Medicaid program so that they could balance the budget or reduce the deficit. They cut the Medicaid program so that they could give out tax cuts to billionaires, period. And that tells you all you need to know about their priorities. They are attacking our profession. They are attacking our patients and their families. And we have no choice but to put ourselves outside of our comfort zones, to get as brave as we can be, and to speak up every day between now and November 2026. You pointed out that this bill doesn't really go into effect. The Medicaid cuts won't go into effect until after the midterms. That is clearly by design. But we know that hospital systems and medical practices are already making hiring decisions and service line decisions now because they see this budget hole looming. So people are going to start to feel the effects of this pretty soon. And it's our job to use whatever platform we have to clearly communicate this to the American people before they go to the voting booth in November 2026.
And I mean, I'm already seeing it from an insurance side. My own insurance premiums for a private insurance had gone up from literally $400 a paycheck. Like meaning for my family. And I turned to my husband, I'm like, wait, why is my paycheck so low? And I'm like, I looked at the thing and I'm like, it's a trickle effect. It's just going to continue to impact everyone. It doesn't matter. And you are inspiring me to continue to speak up about it. Obviously I am without even talking to you, but just know that you have pediatricians like myself. I'm hopeful that our conversation today will inspire not only pediatricians or other healthcare professionals, but also just parents, caregivers, everybody to understand how this is impacting everyone. And I'm worried, and you are too, about the next 4 to 10 years, with this sort of this it just feels like we're in dystopia. Like, how is this even happening? And you said it, like, how do people think this is even okay? And I'm really grateful that you brought up the intent, how let's cut this because it means more money to the people who actually want, the powerful people, the billionaires, when what's going to happen to the children? It's all capitalism. It's all, we don't care about the kids because kids can't advocate. So who's going to advocate for them?
Right.
Oh my gosh.
The 67,000 pediatricians in this country are the ones who need to start the movement to advocate for America's children. And for so long, we've stayed in our comfort zone in places, in the advocacy space. And some people don't even engage in the advocacy space, but we have to move beyond the advocacy space that feels safe because it feels good to be a child health advocate into
Yeah.
just straight up politics, because that is the answer. That is how we stop these attacks on America's children. There is no way to solve these problems you and I are outlining without electing the right kind of people. And to do that, you have to engage in politics. As unsavory and as uncomfortable as it sounds, that's the only answer. So I'm running for the US Senate, which is a very dramatic way to engage in politics. But there are so many other ways pediatricians and people who care about kids can engage politically. They can find local candidates to get behind and support. And what support for political candidates looks like is a lot of things. It's showing up at their events. It's volunteering to text bank and phone bank and knock on doors. It's using your social media accounts to amplify
Yeah.
the folks who are brave enough to put their names on the ballot. And most importantly, sadly, it's donating to candidates who have the audacity to run, because it's a thankless path most of the time, but it is such a necessary path. So we need to support people when they're brave enough to step into these spaces.
Like yourself. And I told you before this conversation how much I admire you. I think I've said it in this conversation for to be able to do the work that you're doing, having the expertise that you have as a pediatrician and mother, and taking it to that next level. And I admire you. I know it's not easy. I know this work is very hard. It's probably harder than being a pediatrician, having to enter a space where you see the corruption and you see the way that the money works and all of that. And I applaud you for doing that. And I am very grateful that I can connect with you and spread your mission and hopefully the mission of other like-minded people doing the work that you are also doing. And we've spoken about how these cuts and red tape don't just hurt patients, they burn out providers. How do you think better policy could improve both patient outcomes and keep more clinicians in the workforce? And in your ideal world, what would that look like? What do you want for the future of American children?
I mean, we do have a workforce crisis in healthcare, particularly when we talk about the pediatric workforce and the
Yeah.
pediatric subspecialty workforce. And I've heard a lot of stories from members of Congress and constituents and leaders in the pediatric healthcare space that once it affects a member of Congress, like their grandchild has a seizure and needs an appointment with a pediatric neurologist, all of a sudden they become aware of our pipeline problem and our workforce crisis. And they realize how untenable this is and how there are policy solutions to address this. So we have to start rewarding folks who go into primary care. We have to provide incentives to medical students who choose to go into primary care fields, mental health care fields, to practice in rural areas where we have healthcare deserts. There are answers to the workforce shortage crisis. We just need folks who care enough to enact them. And we can't expect people to figure out these problems on their own. It's our job to advocate, to draw attention to the problems, to draw attention to the solutions, and then work like hell to elect people who care. And we can find our way out of this mess. But as I've already said, this is such an urgent moment for our profession, for trust in public health, and for America's children. So if you ever had any insecurity or doubts about the need to get loud, please drop those. Our children are counting on us. There is no one more well prepared to advocate and to engage in politics on behalf of America's children than the pediatricians in this country. And if we start doing that, people will follow us. We have a trust problem in public health, but people still trust their individual pediatricians. People trust our profession as a whole, and we need to lean into that and lean into our expertise and drop our imposter syndrome, because we deserve to be in these rooms where decisions are being made, and our children need us in these rooms.
Absolutely. Can I clap on my my own podcast? I I love it. I just think it's so empowering and it's so true. And you talked about how it takes a lot of congressmen or senators to have the personal lived experience for them to make changes. And that's so sad because me and you know that we have the lived experience and we see the lived experience in front of my face every day, like the voices, the tears of my families who are struggling. And it takes just one of them to be like, you know what, yeah, sure, this is a problem. I still remember when the ACIP committee voted on the RSV antibody to be approved for this year, for children. A lot of the reason that happened was because one of the members on that committee had a kid who had RSV, and they were like, well, this is an awful illness. And I'm like, we are telling you that these things are awful. We are telling you that we need to keep Medicaid. We are telling you that this is going to negatively impact everyone. And again, more the squeaky wheel gets the grease. We got to keep getting out there. And I really appreciate that sentiment. And for everyone listening, for those that are in South Carolina and those that are not, what would be your final uplifting message for all of our amazing listeners who are tuning in and hopefully getting empowered and figuring out ways that they can help?
We have so much individual agency. Pediatricians are experts, and we have a platform and we must use it. The good news is there's really nowhere to go but up when we're talking about pediatricians' engagement in politics. So imagine a world where we all discovered our individual agency to contribute to the practice of politics in this country on behalf of America's children. Imagine a world where children are seen as powerful a political constituency as Americans over the age of 65, where every congressional session they're talking about how to improve and expand the Medicaid program, how to strengthen our public education system, how to pass common sense gun laws to address the leading cause of death for children in this country.
Yeah.
If we invest in America's children, it is possible to build the future that every pediatrician out there wants for America's children. But to do that, we have to find new strategies. We have to find a new playbook, throw the old playbook out the window, because the way we've been engaging in advocacy on behalf of America's children has not worked. And politics of 2025 are not the same politics of 1985. And we have to accept that. And we have to play by the rules as they're currently written. And the good news is when we start using our voices, you and I both know this, people listen. People listen to us. People are watching us. They're looking to be inspired. They're looking to find ways to engage. So we could be on the cusp of a really bright future, a bright era for America's children if we choose to engage.
Thank you so much, Dr. Annie. I also want you to let people know where they can stay connected with your campaign, your resources, how they can help if they want to help with your campaign as well. I really appreciate you earlier also talking about how there's so many different ways to get involved, because I also believe the same thing. I don't want to force something on someone in terms of advocacy, but where can people go to stay connected with you and your campaign?
Yes, so the campaign website is drannieandrews.com. I am all over every social media platform at Annie Andrews MD on Instagram and Twitter. I'm on TikTok now and over on Blue Sky. So you can find me. You'll probably see way more of me than you ever wanted to for the next
Yes.
15 months.
You are doing the work. Yes.
Yes. But, my campaign is an opportunity for us all to learn more about how to build political power that centers America's children. So no matter where you live, please follow along.
Yes.
Please contribute if you can. Please watch what I'm doing and understand that I'm just one of you. I'm an introvert. I'm not from a political family or background. I never took a political science class, but I'm doing this for America's children. I've taught myself how to do these things because I believe so deeply in what I'm fighting for. And I know everyone listening believes the same. So just get brave, get loud, and let's do this thing.
Let's do this thing. I like it. And I just love that we are bringing attention to more amazing people who deserve to be in these roles of leadership. And not only because you're a pediatrician, but I believe we need more women who are compassionate. Mothers obviously helps too. I know you mentioned about how pediatricians, but like we're all many of my followers are mothers. You know, many of my listeners care deeply about our children and hopefully about other people's children, and how all of us together. I mean, our listenership here, everyone, is very high. We can all do a little difference to really make a greater impact. And thank you, Dr. Annie, for leading the way in such a large way, but to inspire all of us in big and small ways to get involved. I really appreciate your time and talking today.
Well, thank you so much for having me and for using your platform to allow me to share with your listeners how passionate I am about what I'm doing.
And, Dr. Annie had said something on the show already that it's not our fault that politics in America in 2025 have become so red and blue. And it is that one group is caring more about children. And I want to really drive that point home before we leave, how it is about finding the candidate and the person and the party that is really supporting your values. And I hope that your values can really understand that children matter to our future. If we want them to have a bright future, we have to take care of them and their peers and their classmates, regardless of socioeconomic status. Dr. Annie, thank you for joining me today.
Thank you so much, Dr. Mona.
And for everyone tuning in, please, 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 you already heard how important this is, but subscribe to the channel, hit that thumbs up sign, and share this video. Whether it's this video on YouTube, whether it's on our social, get the word out. That can be your form of advocacy. That can be your form of spreading the word on what Dr. Annie is doing and other amazing people who are running for political office. It's so important that we do the small steps so that we can make a greater impact. And I cannot wait to have Dr. Annie on, hopefully again in the future when she is senator. I'm wishing this into reality because I know she's going to make a big difference and shake up Washington, which really needs to happen. And I cannot wait to chat with another guest next time on the show.